we'll go ahead and get started. And then as people join on, Andy, if you have any specific questions, please put them in the chat and we'll cover them at the end if we didn't um, address them. So some of the things that we talked about last time, I think we could do like a quick recap of, and then kind of dive
Okay.
in deeper into like men's specific hormone health. So
Okay.
maybe let's start with what are some of the most common things that you see with like why men in particular are coming to see you?
Okay. So men specific, what I usually see most of the patients that come in are to check testosterone levels. I'll have to say men generally don't go to the doctor unless they're about to die. I don't know why. Not all men are that way, but most are. So that's what usually gets people in the door. But sometimes I have patients that come in for other things that other doctors haven't been able to figure out, or they're on testosterone therapy and not feeling better, or digestive issues, because that's another area I do a lot of work in. It seems like women in general have a lot more digestive issues, but there are a fair number of men that have those issues also. So usually I see, the symptoms coming in is we want to check. They've either had labs done or have the symptoms of low testosterone. And sometimes they
What
have
are some of
labs.
those symptoms?
So some of the symptoms are fatigue, poor sleep, can't make good gains in the gym. So they're working out, but not putting on muscle mass, having trouble losing weight, low libido, um, things like that. And those symptoms cross over with a lot of other things, but that's typically what are the symptoms are. I'm going to the gym, I'm not getting any results, or I'm not putting on muscle mass, um, or yeah,
And how
libido.
common is that normal, like to see testosterone dropping at what age? Like I know, I've talked to or had family members that are experiencing low testosterone even before they've hit 30. So what is that range? What's normal and what are you seeing that's maybe abnormal?
Yeah, that's a good question. So normally, in the old days, I will say, in the old days, or back when, 100 years ago, when I was a kid, when we didn't have all the toxins in our environment, we didn't have all the stressors, through our pollution and our EMFs and our, other things that we have now. It was a lot more common that we didn't have issues until maybe 40s or 50s. We'd start seeing low levels in men. But now, my youngest patient that I've seen with low testosterone was 18, and his testosterone was like 300. And so with him, we figured out some underlying conditions and started working on them. So sometimes it's genetic. Sometimes, in this particular case, with this young male, he had some head injuries or traumas, TBIs. So sometimes that can affect hormones. There's just so many things, all the estrogen like or endocrine disruptors we have in our food supply and our water supply and our air. So we're starting to see it at really young ages. So even in 30s, I'd say most of my patients coming in now are probably in their 30s or 40s. I'd say the majority, and a lot of them have low testosterone.
Hmm.
So
So you said that they're experiencing things in their environment that are causing low testosterone. Is
I
that
think
correct?
so. Yeah, when I started practicing, they have the normal ranges of testosterone for any lab. When you get labs over off to the right side, it'll tell you what the normal range is. And that normal range of testosterone just keeps sliding downwards. If I compared what it was 10 years ago, it's so we're seeing it across the board. The way they get those normal ranges for the different labs is they just take an average of everyone that comes in and they do a bell curve and put their confidence intervals on them. So we know that levels are dropping. And then we also know there's a lot of these, things that we suspect are causing it. Before I went into naturopathic medicine, I was an environmental engineer, and that's what kind of got me started, is looking at all the endocrine disruptors in wastewater coming out of wastewater treatment plants, which goes right into the river and becomes the intake water for the next city down the road. And so we're starting to see all these chemicals and things that are in wastewater that then go into drinking water for the next town down that nobody's really checking for or really taking out. So that's part of it. All the chemicals in our food, the pesticides are It's just crazy how much pesticides we use now as compared to the past. Um,
So I have two
so
questions for you
yeah.
really quick. So what do you so what is considered a normal range for men now, even though it's changed over years? What's considered normal? And also, if we're getting these endocrine disruptors in our water, what kind of water do you recommend drinking?
Okay. The normal range for men, it's a very wide range. It's like 250 to 950. But
Oh,
we know that
wow.
in general, men are not feeling great if it's much under 500. So that's kind of the gauge. And if you look at like the Endocrine Society in America, I think that's where they recommend starting testosterone treatment is when it's below 500. A lot of regular MDs or DOs won't do that. They'll say, "Oh, you're 251, you're in the normal range," but we know you're not feeling great at that number. So that's where, for me with patients, I kind of look at free and total testosterone, how old they are, and what their symptoms are to decide. Some people feel great at 500, but a lot of people don't. So it's not just the lab number, it's also the symptoms that the patient has. And then for water, that's a good question. There's so much information on water out there, but I think the cleanest, purest water that I found so far is going to be like RO, reverse osmosis water. The problem is it takes out everything. It takes out the good
Right.
stuff and the bad stuff. So then we got to add minerals and things like that back in. But it does a good job at taking out chlorine and fluoride and VOCs and some of those other organic chemicals um, that are in the water that normal treatment plants don't take out. So
Okay.
there's a lot of debate about water, but that's my
Yeah.
opinion.
How do you see stress or lack of sleep affecting testosterone levels in men?
That's definitely stress affects everything because with stress, we start getting poor sleep, poor nutrition. Um, so it's kind of have a systemic overall effect. It affects your adrenal glands, which are involved in the whole hormone signaling pathway, affects metabolic issues. So sometimes with stress, we start seeing high cortisol, then maybe we start getting into high blood sugar, diabetes. So stress is a huge factor. It's unfortunately something that we all have way too much of. Um, so stress management is certainly a good piece of any kind of a treatment plan to make sure that you're getting good rest, good sleep, taking a break. It's not always possible. I do have, a fair number of patients burning the candle at both ends because they have a young family, they have spouses, they have parents they might be taking care of, one or two jobs they're working to try and pay the bill. So it's not easy always to manage stress, but that's certainly an important piece of a treatment plan.
So I know, a lot of people will use exercise as a stress reliever, but can excess exercise or a really extreme form of exercise contribute to stress, like physical stress? Can that affect testosterone?
Yes, I think so. What you can do in your 20s as a female or a male is different than 30s and 40s and 50s. And I think some people, we have that mindset that the more we work out, the stronger we're going to be. But at some point, you stop recovering. Then you
Yeah.
start overtraining and having injuries and inflammation. In women, we see in over exercising women, hormone imbalances like PCOS, which affects a lot of things. But in men, I think it just does start lowering testosterone, and then that high cortisol eventually turns into low cortisol, so we're having trouble recovering, not sleeping well, those kind of things. So there's got to be a balance with exercise, especially as we get older.
Yeah. Yeah, I've definitely felt that, like, in the last year, I've felt like my body doesn't recover as quickly and I have to listen to my body and not approach every workout as extreme as I did even just a year ago. Yeah.
Yeah, yeah, it's a fine balance sometimes, to figure out where that is, where you're still making gains and feeling good, but not over or underdoing it.
Well, and I
And
also
with
like
cross
this brought up, I mean, I didn't think about this until right now, but I think about the amount of stress I'm under in other parts of my life, like just with building my business over the last few years. And I think maybe that may be contributing to why I don't I don't feel recovered, why I'm not, because my workouts haven't really changed, but
Mhm.
that part has.
Yep.
And so now I'm
Yeah.
like, oh, maybe that's why I don't feel like I'm recovering and why I don't want to work hard at the gym anymore.
Yeah. Yeah.
Yeah, we call that burnout at some point in time, right? You just go, 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 and then at one point you're just like, I can't go anymore. I need to stop and rest for a little bit. So
Yeah.
that's why these holidays are nice, especially at the end of the year, because everyone kind of slows down and we take some time off. If you're lucky, you get to do that and just rejuvenate. I know my son is in college and he came home this weekend. He literally slept 18 hours a day for 3 days because I know he's not sleeping at school and he's only 18. He can get away with it, but
Yeah, I've actually read studies about teenagers and how they sleep a lot on the weekends because they need it.
Yep.
It's not because they're being
Mhm.
lazy, they actually need
Yeah.
that extra sleep
Yeah.
on the weekend.
Yeah, and as we get older, it's just harder to do that, right? When you're in your 20s, you can get
Totally.
away with missing a day or 2 of sleep, but when you're 40 and you miss a day of sleep or 50, it's takes a week to recover from that. So that's the other, when I have patients get started on testosterone therapy, one of the first things I hear is I'm sleeping so much better, which surprised me at first, but now I expect to hear that because that's just all part of that cycle,
Yeah.
that stress cycle.
Okay, well, let's
And
kind of
then,
stay on this. Oh, go ahead. Did you
go ahead.
I was gonna say, let's kind of stay on this testosterone topic since we're talking about it, and then we can kind of touch on some of the other things that you're seeing men for. When you have somebody that comes in and is concerned about low testosterone, what are the tests that you're ordering for them to get done? And tell me the difference between, like, what are you testing for?
Okay, my standard sort of panel that I run would be a CBC, which is a complete blood count. So that tells us about your red and white blood cells. One thing that we have to watch for with testosterone therapy is in men, especially because the higher doses, it can increase red blood cells, hemoglobin, hematocrit. So we got to keep an eye on that because if those get too high, that causes other issues. So I always check the complete blood count and then a CMP, which is complete metabolic profile. Those are pretty normal labs that any doctor would order on a wellness panel. And I usually check a cholesterol panel to get an idea. We see a lot of things in a cholesterol panel. There's 5 different types of high cholesterol. So depending on the pattern of the HDL and the LDL and the triglycerides and all that, helps us design a diet that fits with the patient's genetics, so to speak. And then free and total testosterone. Total is, the free is what really works in the body, free testosterone. And then total testosterone is how much is free plus how much is bound up. So we like to see that. And some patients have a really nice total testosterone level in the 700 or 800s, but their free testosterone is really low. So if that's the case, then we need to look for other things, underlying inflammation or maybe low grade infection, something that's binding up that testosterone. So that's important to look at. And then I look at estradiol, which is a metabolite of testosterone. It turns into estrogen. And we need to make sure those levels don't get too high in men.
Okay.
And then the other main one I do is a PSA, the prostate specific antigen.
Mhm.
So those are sort of a basic panel, but I usually, for a first time patient, I'll look at their hemoglobin A1C, which tells us how well their blood sugars are controlled. I usually like to run an iron panel at least once on a male patient, to make sure it's not too high or too low. A lot of doctors never check iron levels in men, but I've caught a few cases of either hemochromatosis or low iron in patients that haven't ever been diagnosed. So that's just one of the other things I run. So that's kind of my comprehensive wellness panel that I start with
Okay.
for men.
So, Andy, I know Andy put a question in the chat. He said he's a 46-year-old with a recent testosterone score of 740. He's wondering if that's good. And I think you kind of already answered that. But one of the other questions he had was his glucose score is 112 when fasting for 8+ hours. And could that act like low T? So I'm not quite unsure how to understand that question. So maybe you could explain a little bit.
Oh, yeah. So I would say that it's a little bit high for fasting glucose, but a better number to get would be the hemoglobin A1C, which is it's kind of a 3-month average of your blood sugar control. Some people can have a high fasting glucose, but their A1C is really nice and low. But there are a lot of overlap in symptoms between prediabetes or diabetes and testosterone. So that's 740 is a great number. Did you get, I don't know that I'm talking to you or that you can talk back, but did you get free testosterone checked?
I honestly don't know if that was free or total. I would have to go back and ask. And I also do not know if they did the A1C or not.
Okay. Yeah, the 740 is definitely a total. So you'd have to look and see if they did a free testosterone level also. And then the A1C would be great to get. Yeah, I have had a handful of patients come in. Like I've got all these symptoms of low testosterone. It turns out they have diabetes. So a fasting glucose of 112 doesn't necessarily diagnose diabetes. I think 126 fasting glucose is the number. But that hemoglobin A1C is another way to check that and see where you're at.
Andy, did you go to Trevor?
Yeah.
Okay. Yeah, you just ask him if he tested that. I bet he did.
He probably did, and he may have even told me. I just don't remember it.
Yeah. Okay. So free testosterone normal ranges are what?
Well, that's an interesting question because LabCorp's range for free testosterone is off. So it depends on if I don't know, they have something wrong in their math equation. It's kind of funny. So let me look that up off the top of my head. Hang on a second, because actually, wait a second. Let me think. Because there's different ranges between the different labs. I can't remember that one. Do you know, Andy, did you have LabCorp and Norquest?
It was done at Dr. Wilkins' office, so I don't know if he outsourced it or if they did it locally in their office.
Okay.
I'll see if I can't find a piece of paper that has this information.
Okay. So for some reason, and I've talked with other doctors, and I'm really sure that LabCorp has the wrong math equation down. So their free testosterone range is 6.8 to 21.5, but Sonora Quest is like something to 380. So that's a tricky question to ask without knowing which lab ran it. One day I'm going to call LabCorp about that.
Okay.
But if you just Google it too, there's ranges. I think it goes to 380. I'm trying to think who has used Sonora Quest recently that has that range listed. But it kind of needs to scale also. Like you'll have a normal range for total testosterone and then the free testosterone range. So I always kind of look like if total testosterone is right at the top of the range, we want free testosterone to also be at the top of that range.
So I just looked
that
it
make
up
sense?
real quick. I just Googled it real quick and it said
Yeah.
300 to 1,000 nanograms per deciliter or 10 to 35 nanomoles per liter. So I'm wondering if maybe they're measuring it different ways. Sonora Quest versus.
Yeah. I've looked at that and it seems like they have the wrong units on LabCorp, like they did that second one that you told me.
Yeah, in nanomoles.
Yet their ranges are still. So for example, here's a male patient and it says the free testosterone normal range 6.8 to 21.5 and it's picograms per milliliter. But you said
nanomoles per liter.
Yeah. And I've done that math somewhere. I don't have it right in front of me.
Okay.
So
yeah. It can show, basically what you're saying is they can show that you have normal testosterone levels, but you could not be in normal range for free testosterone, which is what really matters.
Yes. And so for example, I've had a couple of patients with their total testosterone is in the 700 or 800s, but their free testosterone is so low. They have all the symptoms, but giving them more testosterone isn't going to fix that. We've got to figure out how to get free testosterone unbound. And so there's things like boron is really well known for that, and some other herbs. Usually you'll find them in herbs that are designed for men that can help free up that free testosterone. So that it definitely needs to be checked just to have an idea if it's within the right range or if there's something else going on that's blocking it.
Okay, that makes sense.
Mhm.
So
Yeah.
what
And then
are the treatments for low testosterone? What do you usually recommend for somebody that comes in for low testosterone?
there's a few different approaches. It kind of depends on the patient and their preferences and their age and if they're planning to have kids or not. If I've got a young male who is planning to be a father in the future, the my favorite approach to start with is to do an oral medication called clomiphene. It's also used in women for fertility treatment, so that's where most people associate it with, but it's also used in men to help your own body make more testosterone, and I do that in a compounded formula with some DHEA and some estrogen blocker, so it's usually coming from a compounding pharmacy, and that way it preserves your sperm counts and sperm levels as opposed to doing testosterone injections or topical creams. With those, we can get testosterone levels up, but we have some side effects. And it doesn't always cause low sperm counts, but it's always a concern that it could. Um, and then testicular shrinkage, which isn't really a medical issue, but for some reason, some people don't mind that side effect and some people do. So there's those kind of things, injectable versus topical. Some people don't like giving themselves injections or don't like needles. That's where a topical would be better. So those are the three main approaches I use would be that oral daily capsule that's compounded with clomiphene or testosterone injections or testosterone topical cream.
Okay.
And then we also look at adrenals and blood sugar and all those other kind of things to really hopefully optimize that treatment
So
plan.
one of the things that I've heard just from men in general is that if they start taking testosterone, they can't ever get off of it. So is that a myth? Is that true? Like, what are some of the things you've heard about that?
I've seen some people do that successfully get off. Kind of the thing that we're taught as doctors is if someone starts at, say, a total testosterone of 400 and we get them on therapy and it goes up, if we take you off therapy, it should go back to where it was originally. And sometimes it does and sometimes it doesn't. But there are things that you can do. I've had some people wean off the testosterone directly and start some of the clomiphene to get your own body rebooted. We used to use HCG injections, which we all think of for weight loss, the HCG diet, but it's also used in fertility treatments. And for men, it can stimulate natural testosterone production. So for some of my patients that have been on testosterone therapy and they want to, their sperm counts are low or they want to have kids, I'll either switch them to this clomiphene treatment or maybe do HCG. And I've had one patient, it's really fascinating. He was told his sperm count was 0, he could never have kids. And when he came to me, his testosterone was like 273. And so we put him on this oral clomiphene formula and his wife got pregnant.
Oh,
And I
wow.
mean, they just had given up. They didn't think they were able to ever have kids. And so it actually was amazing that worked. So
That's
yeah,
really
it doesn't
cool.
work in everybody, but it's nice. It's just always exciting when it does. So
Yeah.
um, but the other things that really can help get your own natural levels up, anyone with sleep apnea needs to get that corrected because that takes a toll on every part of your body. So I usually ask questions on my intake if someone snores or if they know they have apnea. We can see some things in labs that might indicate apnea, and that'll take a toll on everything. So I have done a fair amount of referrals for sleep study tests for patients. Um, and then diet, just cleaning up the diet, getting all the sugar and the artificial flavors and colors out of the diet can make a huge difference. Getting the right nutrients in, having the right amount of exercise, not too much, not too little. All those lifestyle factors can really make a difference.
Yeah.
And
Okay.
sometimes I've seen someone, it was a kind of a slow process, but go from the 300s to the 900s on total testosterone just by doing that, changing diet, getting the sugar out, adding exercise, especially weightlifting, and then working on sleep, getting more sleep,
Those are the
working on
hard
stress
things. Nobody
reduction.
wants to
I
do the
know.
hard things.
Right.
They
Nobody
just
has
want
time
to take the
to.
shot.
Yeah, which we can do. But yeah, it's always
Yeah.
great to work on everything. But we just live in this world where we're so busy all the time.
Mhm.
So
what are the negative side effects to actually being on hormone replacement therapy for a long period of time? Does your body actually stop producing its own testosterone, or how does that work?
I would say I've seen enough people in my practice where we can come off of it, either wean off or switch to this oral tablet. Um, the long-term effects of low testosterone we know are definitely increased cardiovascular risk factors. So there's a good optimal range that's great for people to stay in. Too much has side effects. So when we get people that want to be like, what was that guy's name? Piani, Rich Piani, who was doing way too much testosterone, his heart just literally exploded one day. We have to make sure we're not too high on that testosterone dosing. But to keep in a normal therapeutic range has a lot of benefits in general and minimal side effects. I'd say, one side effect would be the low sperm count if fertility were a concern. Certainly, if there's any kind of prostate or testicular cancer, we'd stop treatment until that was resolved. It doesn't cause cancer, but if you have cancer, it could possibly exacerbate is kind of the rule of thumb that we go by. So that's why we check PSA every time. I get labs on male patients just to keep an eye on that level. Injections, sometimes people get tired of giving themselves injections, but I don't think if you do the injection in the exact same spot every time, you can get it's called a pseudocyst. So that's why I recommend that you just rotate application or injection sites so you're not always putting it into the same area. So what else? We got to keep an eye on labs, make sure the red blood cells don't get too high or estrogen levels don't get too high. So those are all the side effects that need to be just monitored and the plan adjusted to keep all those within normal ranges. So
Okay.
I think the long answer is as long as we're keeping an eye on all that kind of stuff, I don't know of any really long-term negative side effects if we're doing everything right.
Awesome.
So
Well, let's switch gears a little bit. I want to talk about something you said about checking iron level in men. So I actually have a client who his iron levels are extremely high, and
okay.
he's doing it's called bloodletting, I think is what
Yeah.
every 2 weeks, and taking supplements and doing heparin injections to help lower his iron levels. And he's having a pretty strict no iron diet, basically. So tell me, I know like with females, we have a tendency to be low in iron deficient, just because we menstruate. Most of us menstruate monthly. Well, men don't obviously do that. So what are some of the side effects, I guess, of having high iron in men, and what are the options to help lower that?
Okay. There's a genetic condition called hereditary hemochromatosis, and that's where your body absorbs too much iron from your food. And there's different variations of it. Some people have the genes, but don't really have a lot of high iron, and other people have to give blood every 2 weeks to manage that. And so that's one thing. A lot of males, I usually check iron on their first set of labs when they come in because I just want to know. And I've caught, I think, 3 cases so far of hemochromatosis. They had no idea. I'm like, all right, now you got to tell your brothers, your parents, your relatives, just get checked, because the sooner you figure that out and start managing it, the better off you are. With enough time, those high iron levels are very oxidative and cause a lot of damage to your internal organs and tissues. So that's the reason you want to get checked and start managing it as soon as possible. But the tricky part is for some people, it is literally having to give blood every 2 weeks because it's such an issue. With testosterone therapy, we don't necessarily see increased iron. We can see increased red blood cells, which we need to manage, but iron is a whole different beast. And so it's not necessarily caused or aggravated by adding testosterone therapy, but it definitely needs to be kept in check and looked at. So the other things for obviously someone who has this condition, there are certain nutrients that can be helpful. I found a great website, and it was by a naturopathic doctor, and it has some nutrients that can really help with managing high iron. So if you have black tea with a meal that has iron with it, the black tea will block iron absorption.
Okay.
Calcium will also block iron absorption. Antioxidants are great because high iron levels in the body are very oxidative. So we want to increase antioxidants in those patients. And obviously avoiding iron, any kind of supplements with iron in them, cooking out of iron skillets. A lot of food in the old days was iron fortified. I don't know if they're still doing that with cereals and things. So just make sure every once in a while I find a male patient who's taken his wife's prenatal vitamins. And so iron's only temporarily high. And so once we check that, we're like, all right, you need the non-iron added one. So yeah, it's definitely something that there's very few people, I think, that have that condition that this person you're talking about, where it's every 2 weeks they're having to bloodlet, so to speak. My patient that has the biggest issues, I'd say he probably goes in every 4 weeks, but that's only one patient. The rest, if they tend to have high red blood cells with testosterone therapy, it's usually every 2 to 3 to 6 months they go in and donate blood.
There,
And
a friend of mine's boyfriend's dad, we were actually talking about this, and he was saying that they call it the Irishman's disease or something like that.
Huh.
Yeah, I thought it was really
oh, okay. Yeah, maybe it runs. I have it. I didn't know that. It probably just those genetics run stronger
Yeah.
in Irish people.
yeah.
Maybe that's
Yeah.
why they're also red-faced.
Yeah.
Maybe.
Yeah, I was talking to him about it because my iron, when Trevor did my blood a couple years ago, my iron was really high, and he was like, just go give blood and make sure you're not taking a supplement with
Yeah.
iron in it. And so
Interesting.
I keep track
Yeah.
of it, and so far my iron levels have been fine, but I just kind of make sure.
Interesting.
Yeah,
Yeah,
and I'm Irish.
yeah.
so.
There you go. Well, in women, you could still have that condition, but because if you're still menstruating, usually we don't see it show up in women until menopause,
Right.
because that's when you're not losing it every month. And then, so that might be at some point you might want to get a genetic test, or at least
Mhm.
just keep getting it checked on your labs.
Yeah.
So, yeah, so there's, and then I've caught low iron in a few males. As soon as a male has low iron, there's a few things we check. One would be for celiac disease, because if you have a lot of inflammation in your digestive tract, you're not absorbing nutrients. That can be one cause. Otherwise, it's some sort of internal bleed, most likely. So I'll send them to a GI doctor for a colonoscopy. And I had a really peculiar case recently. A patient ended up having a little bit of a tear in his pericardial sac. So he was actually bleeding from his pericardial sac. And he was lucky enough that got caught by a pulmonologist who he happened to go see because he had a history of valley fever. So that's a pretty rare place for men to bleed, but it was interesting. He had been my patient in the past, but he wasn't under my watch when he was doing a whole lot of testosterone. Ended up with enlarged heart, and I think that may have caused the tear or contributed to it. So you never know.
Yeah.
So the other thing with low iron, when I see that in men and we can't find any other cause, for me, that's also another thing to consider: sleep apnea. So I've had a couple patients with sleep apnea, and once they get that corrected, that ferritin level comes back up too. So that's why there's just a few different things that it could indicate whether it's high or low. So
Okay.
Interesting.
So what other things do you feel like you want to share with us about men and hormone health, or health in general, that you're seeing?
I think, I always say men are my easy patients, because with women and the estrogen going up and down all month long, we tend to have a lot more thyroid issues and more autoimmune conditions and more digestive issues. But there's some of that happens with men also. It's just less frequent and less common. So, I always ask some basic questions on my intake about digestion, gas and bloating, heartburn, those kind of things. Because if we're not, our digestive tract is one thing that really has to function well for good health. It's like, one of we call them foundational things. We're trying to build a house on a good foundation, and with the house being our health, we got to start with good absorption of our nutrients, good digestion. Our digestive tract does a lot of work making neurotransmitters, and those kind of things. So we always want to have good digestion, and then check thyroid. I usually do check thyroid in everyone at least once. Men tend to have a lot less autoimmune or thyroid issues in general, but we do every once in a while find that nobody's found before. They're just tired and they have some symptoms of testosterone. It turns out to be a thyroid issue sometimes. So, but generally, there's just they're just easier in general to treat because there's a lot less of these other autoimmune and other issues. But but we do find them. So I think, especially someone who's been on, I find a lot of men, like they've been going to a clinic and they are just going in, they get their labs done every once in a while, and they're getting injections. And all of a sudden, usually what happens, insurance stops covering them. So they come to me. And so I'm checking all these things that have never been checked before. And, they just aren't managed well, like Ageless Men's Clinic. They're not really looking at anything else other than testosterone. And so I think that, what me and probably most naturopathic medical doctors do is a little bit broader. Let's look at a lot of stuff because, testosterone's only a part of not feeling great. There's
Right.
other things to consider.
Yeah, I love that.
So, and then the other thing I mentioned to you when we were chatting earlier via email was lately I've been checking. I had a patient come in with a lot of symptoms, just fatigue and irritability. And so we start asking questions. It turns out he's a police officer and he works at the range and he's just handling,
Right.
ammunition and stuff all the time. So we checked his lead and it was just sky high. And so a lot of the symptoms of lead poisoning or high lead also overlap. And it's something I don't do enough with my police officers, but I need to start just doing a blood level and see if that's high. So he sent a coworker in and his coworker was even higher on lead. So
Gosh, interesting. So what are some of the side, or what are some of the symptoms of high lead?
the ones, kind of the main ones, headaches, stomach issues, constipation or stomach cramps, muscle and joint pain, irritability, fatigue, loss of sleep, lots of sex drive. It's all the same as testosterone symptoms. There's see how everything overlaps. So that's another one that I've got to at least start adding to my standard panel for anyone who's shooting guns or going to the practice range. Some people even make their own, reload their ammunition at home in their garage. And lead is something, we all know they took lead out of gasoline. They took lead out of paint. And so the biggest exposure that I know of is ammunition, but I'm sure there's other things that have lead in them that we can come in contact. And it just goes probably through either through their skin into their blood or they're breathing in the dust. It's getting into their lungs and into their blood. So that's a good time.
Overload lead lead in the blood? How do you treat that?
We usually do a chelating protocol. So I do an oral chelating, DMSA. So there's different ways to do it. We can either do 2 days on and 5 days off, or 4 days on and 9 days off. It's kind of a week to 2 week cycle. So the first 2 days, we just load the patients up with a certain amount of DMSA, and then we take some time off and we bind it up. So we do a lot of support nutrients. When you chelate the lead out, you also take other things with it. It's kind of like RO water. You take out the good and the bad. So then we got to replete nutrients and minerals and those kind of things on the during treatments. Add in binders like activated charcoal or zeolites or some of those things to help bind up. When we get it kind of in the blood, we want to bind it up and get it out of the body. So it's a fairly intense program. I usually do like 10 weeks of chelating, and then we recheck levels and see where they're at. So, and then some people have, if you have a mouthful of silver fillings, you could have some mercury toxicities. Everyone's got a different capacity to detox things too. So we can all have the exact same exposure outside and have different levels inside, depending on our genetics and our stressors and our detox pathways and supplements and nutrients. There's just so much to consider. Sometimes it takes a round or two or levels or layers of treatment to really get people feeling good, depending on how toxic they might be.
Right. Yeah.
And then recently, I've gotten a couple of people with that high total testosterone, but low free testosterone. And I will run a test to look for glyphosate, which is the Roundup, basically pesticide or herbicide that's it's all over our food. Even the organic food we get has some of it in it. And that's, if I see that come back high, those are people that don't detox well. So then we just do a little extra detox stuff with those patients too. That's kind of part of the protocol for those particular patients, is to figure out what they're not detoxing from and support that.
Okay.
So.
Well, I feel like that was a lot of really good information. Is there anything that we didn't touch on that you would like to talk about before we sign off?
I think that kind of covers it. I mean, I guess my biggest message, you can have all those symptoms, but it's not always testosterone. We got to look at all these other things and really work on optimizing overall health and not just focus on that number. Um, and, and just keep an eye on all the labs, and we can keep everything. I've had patients with me since I've been practicing. They're doing great. So it's just a matter of doing it correctly, in my opinion. So
one more question that I just thought of: how frequently should a man maybe in his 40s get tested for testosterone and some of these other things?
I would say if levels are good, just once a year, an annual set of labs, if you're not on any kind of therapy, just to keep an eye on stuff. That's kind of the general recommendation. Go to your PCP once a year and get labs. If someone's actually on therapy with me, I check labs every 6 months.
Okay.
Mainly testosterone is a controlled substance. So I can only prescribe it for 6 months. So that's the normal
Okay.
frequency I have patients come in. If I get someone on that oral compounded capsule after 2 or 3 visits, when we figure out how they're responding, sometimes with those patients, I'll go a year between visits because they're pretty stable. So, but with injections or topical creams, it's every 6 months.
Okay. I have one more question I just thought of. So,
Okay.
and this is more of a personal question, I guess. So I am on testosterone with you, but mine is an oral testosterone that it's a troche that I put under my tongue. Someone recently told me that can be damaging or hard. I think they said on your liver, maybe. Tell me why that would or would not be harmful for me.
Okay. So part of the lab tests that we check, the CMP, complete metabolic panel, shows us liver enzymes. And so that would be, I keep an eye on AST and ALT. The idea with the troche is that most of it absorbs. You obviously swallow some of it, but ideally we're absorbing in the blood vessels underneath our tongue. So for women, that's fine. For men, it is a pretty big dose because the levels for male replacement is, times 10, a lot higher. And I've tried it with a couple of men, and it just, I don't like it. But for women, as long as we don't see elevated liver enzymes or any other side effects, I think it's a pretty decent way to go for women. A topical cream. I just went to a great conference, and they're talking about topical testosterone creams for women have an increased metabolite of, I think it was DHT, which is, increased risk of like male pattern hair loss and acne. And so I think the oral troche or, an injection might be the best way, but it's such a tiny amount for women. It's hard to control without being, really high and then really low.
Oh, yeah.
For,
that makes sense.
yeah. And some women don't like doing injections, but that might be the safest way. I'm not a huge fan of pellets. I don't offer pellets, but a lot of men and women do pellet therapy. And when they work great, they're great. But a lot of times they don't. They either release too quickly or they don't release quickly enough, or you get an infection, or it really can drain your adrenal glands. So it's a nice option for those patients that it works well in. It's not cheap, but it's something where you go in I think for men, it's about 6 months. They go in and get new pellets. For women, I think it's every 3 to 4 months. So it's a little bit more spendy.
Okay.
But
Well, that was helpful information. So tell us before we sign off how we can get a hold of you if some of our listeners want to come and see you, what's the best way to do that?
the best way is just to call the office and schedule an intake appointment. And so I work out of AZ Chiropractic, and the phone number is 480-899-9923. And so I always tell people, don't be surprised when they answer the phone, AZ Chiropractic. My name is not in the answering of the phone, but that's where I work out of, and they can schedule. Usually I do an hour intake, and then we order labs, or some patients come with labs. So that's the best way. And then I think what we did last time, if anyone comes to see me from this, as you, for the referral, is I discount the new patient intake fee.
Yeah.
That's what we did last time, right? Yeah. So my new patient intake fee right now is $155, but my discounted rate is $125,
Okay.
which is the cost of follow-up. So
That's Great. Sweet.
Just got to let me know that this was the referral
And
source
you work,
to get the discount.
with insurance and all of that, right?
For labs, yes.
labs.
So that
For
I'm
labs.
out of network for all insurances. I do have some patients with really low out of network deductibles. And so I can give those patients, I'll give them a super bill and they can file for reimbursement. But otherwise, most people have a high out of network deductible. So, but we can always do that. But labs are covered the same if I order them as any other doctor, with the exception that they won't cover Medicare and Medicaid won't cover naturopathic doctors. So for my patients that turn 65 and go on Medicare, we usually either get them a primary care doctor who will order the labs, or else they'll do cash pay labs. I have pretty good cash pay prices for patients that don't have insurance.
Okay, great. And I
So-
know if you just go to azchiropractic.com, your photo's right on the front page, and you can definitely contact you that way as well.
Correct. Yeah.
All right. Well, thank you so much for all of this information. It was super helpful. I feel like my husband needs to come and see you. I don't think he's seen you yet, or maybe one time he came to you. I can't remember. So we may be making an appointment soon.
Okay. Sounds good. Looking forward to it.
Thank you so much. Have a good night.
Thank
All
you.
right. Thanks. You too. Oh, you're welcome.
Bye.
Bye.